Hi everyone, I'm Gary Nice. I'm the Chief Executive Officer and the founder of AdSana, and I'm here with Dr. Tom Tsang, who is also one of the founders of AdSana, and he's our Chief Science Officer. I wanted to give you a chance to meet him and get to know him like I do, and you can understand his background and why he is so passionate about this treatment and cancer research for that. Tom, you started cancer research in 1985.
Yes, in 1985, that's when I received my biochemistry degree from University of Arizona. Then I continued to study cancer and biology, and eventually start doing treatment.
Okay, so you worked on your PhD at the Arizona Cancer Center,
Yes,
which is part of the University of
yeah,
Tucson,
it's
correct?
University of Arizona Cancer Center.
One good thing, so your research has been at the University of Tucson's Arizona Cancer Center for 30 years.
Yeah,
So
it's
you got some
been
stability, huh?
about 30 years. Some of that time I have spent in China to continue the work there.
Now you went to China in 2009.
Yeah, it's beginning in 2009, I spent most of my time in China. I go back and forth, but most of my time is in China.
Okay. Before we go into why you went to China and not here, tell us your opinion of treating cancer and where are some of the issues that you feel that modern cancer research is not even looking at and they need to.
I'm a scientist, so I view the treatment from a scientific point of view. And the way we treat cancer right now, the standard treatments for cancer are not the best science. We're not using the best science. And
Can you explain that?
yeah, because for example, we know chemotherapy, that's a part of the standard treatment. Chemotherapy destroys the immune system. We know, that as well. But we also now know the immune system is very important in keeping us healthy, including continue to fight cancer cells. So during the treatment, you destroy something you need to keep yourself healthy, and that would be, scientifically not a good idea. And there are many other things in the cancer treatment, the standard protocol that's being done right now, that doesn't incorporate all of the science, the scientific knowledge that we have.
And can you clarify what you mean by that?
One of them is that, for example, we know that cancer cell metastasis, so the spreading of the cancer cell from one place to another, cause most of the death caused due to cancer. But in terms of the treatments, we're still very focused on the primary tumor, which is the part of the cancer that did not spread. And in fact, you measure that as to whether the treatment worked or not. But the most important part of treating cancer is whether you can kill the cells that have spread and it will continue to spread.
So in layman terms, what you're basically saying is that at present, their treatment is based on the existing tumor and not necessarily caring as much about the cancer spreading.
Yeah.
But I always hear them talking about the Mets. We're trying to get the Mets, and that's what is the metastasis, correct?
If you look at the standard treatments for cancer, surgery is very good at taking out the primary tumor. Radiation, of course, is very good at that as well. But you need to know where the tumor is, in order for radiation to work. The only really good treatment we have for metastasis is chemotherapy. But chemotherapy, we know it comes with some downside, as in it also harms and destroys the immune system.
It's poison.
Yeah, well, yes, it is. And,
It's killing all cells.
yeah, it's killing all cells and all cells that are dividing. And the immune cells in particular are very important to fight cancer. You have to have those to continue.
A strong immune
Yeah,
system.
strong immune system is it's part of the cancer fighting weapons that we have.
So what you did in this treatment that you came up with, you realized that we have to do two things. We have to kill the primary cancer, the tumor, or shrink it enough that it can be operable and we can take it out. But you also have to stop the spreading of the cancer.
Yeah.
Now, you call those cancer stem cells.
Yes, it's not something I invent. The field of cancer research has always known that not every cancer cells has the ability to spread to another site and continue to spread. And these, they're called cancer stem cells. They have the ability of stem cells in that they can go from one place to another and they can change. They can go to different locations in the body. So in this, they have the ability of stem cells.
So they work harder? Would it be fair to say they work harder because they're spreading the cancer and they're replicating than the cancer cells and all the other cells in your body? Is that fair to say that?
Yeah, I wouldn't call it work harder, but they're different than the cells that cannot spread.
Okay.
Because metastasis is complicated process. You have to go from one place to another, and you have to be able to stay there and keep growing and grow another cancer, another tumor, and continue to do that again and again. So it's a very complicated process, and it's a part of cancer research that has not received as much attention compared to just finding out how cells grow. So most of our thinking, most of our drugs, the new drugs that's being worked on really targets the growth of the cells, not its ability to spread.
Okay. So around 2007, 2008 is when you started working. When did you start actually? Because I know in 2009 was your first person you treated. When did you start to come up with this concept that you have?
Yeah, really, it started about 2005. That's
Okay.
when we were thinking about what caused cells, cancer cells, to have the ability to spread. And that's when we realized that, in order for cancer cells to spread, it has to pick up all of the ability of a stem cell, because stem cells can move, they can change, they can generate more of themselves, and so that's really when we start to really think about the process.
So I'm thinking when you're talking about this, because if what we're doing with this treatment, we are basically depriving the cancer cells and the cancer stem cells from their energy to multiply.
Yep.
So to me that means, like, do the stem cells need more energy than the regular cells?
Yeah, maybe I should go further back in history. Is that it has been known for about 90 years that cancer cells, they don't use energy the same way. They of course need energy, but how do they get their energy? They don't get it the same way as compared to other normal cells. They get their energy through fermentation of glucose, as opposed to regular cells, non-cancer cells. They actually burn the sugar. They burn the food for energy, whereas in the cancer cells, they ferment the food. And because of that, they have to have a lot more sugar, a lot more glucose than normal cells. They consequently are always starved of glucose.
So if you take away the energy source, is it fair for me to call it energy source?
Yeah, it would be energy.
If you take away the energy source from the entire body, the normal cells can deal with that longer than the cancer stem cells and the cancer cells. So if I understand this, the first that will be weakened by taking away this energy is the cancer stem cells, and then will coming the regular cancer cells. So in our treatment, it runs for about 70 to 90 minutes, and then we stop the treatment. So in that time, what we're trying to do, if I can explain this to everybody who's watching, is that we're trying to take as much energy away from the body during those 90 minutes so that we weaken the cancer stem cells and the cancer cells, and then they're so weak we just use 10% of the chemotherapy drug, and it's just as effective as 100%. Is that correct?
Yeah, what you said is correct. But the way I would explain it is that cancer cells, cancer stem cells, they have a weakness. That is, they have to use a lot more glucose. They have to take in a lot more glucose just to get the same amount of energy. So consequently, they're always starving. They don't have enough glucose, just to do what they need to do. And one of the function that they need this the glucose to do, this energy to do, is to defend themselves against the chemotherapy drugs.
Oh.
Yeah, the key component here is the multi-drug resistant proteins. These are pumps on the surface of cancer cells. They defend the cancer cells against the drugs, chemotherapy drugs that's used for killing them. And if you deprive the cancer cells of the glucose, so they don't have energy, they also cannot operate these multi-drug resistant pumps.
So if I understand the multi-drug resistant, MDR, multi-drug resistant pumps is, let's think of it as a straw.
Yeah.
And something comes in and it shoots it out.
Yeah, it actively pumps the drugs back
Okay.
out.
And is that not why they use so much chemotherapy in the normal treatment? They use those huge dosages that make people get sick, lose their hair and other things. It's because they're fighting against those MDR pumps and they're shooting it out as much as it's going in?
Yes, the cancer cells, they have a lot of these pumps, a lot of these multi-drug resistant proteins, and that's what gave them the ability to be resistant to the drugs.
And so if we weaken those, because like you said, they need that more than any other cells. They're constantly hungry.
Yeah.
And they need it. So if we take that away, those pumps don't work.
That's how you would want to treat cancer cells, is without them having their defenses, multi-drug resistant proteins all operating. So that's very important when you want to successfully treat cancer, is to take away their defenses by denying them of the glucose they need to operate them.
Why haven't they been doing this if all science knows that if you deprive them of this energy, you would think, and I know you were saying something about they want to do it because they need to create a new drug instead, and we
Yeah.
don't do that.
Because in cancer research, the way a new thing come out is through clinical trials, large clinical trials that are very expensive, hundreds of millions of dollars. So they need to have a new drug, and everybody's looking for a new drug that can deprive cancer cells of glucose.
Have they found some?
And they have found many, but the problem with new drugs is that they have side effects. Drugs have side effects, and so not only do they stop the glucose go to the cancer cells, but they also stop glucose go to the heart and the brain, for example, and that can be very big problem for the patient. And so what we are doing, that they're not doing, is that we can control the process of denying the glucose to the cancer cells and other parts of the body through the timing. So you want to be able to do this for 10 minutes, 20 minutes, 30 minutes, maybe an hour. But you need to be able to control the process completely, so that when you want the glucose back into back to the brain, to the heart, and you want to be able to do that right away.
Is this because within that span of a half hour to an hour, we're only affecting, because the normal cells can deal with that?
Yeah.
And so they're not really harmed that much, but the other ones, the cancer cells and the cancer stem cells are, so their MDR protein pumps are not working. So we then stop it so that the normal cells won't be affected.
Yeah.
But with drugs that are ongoing and ongoing, all cells are affected.
Yeah, once you put a new drug in the body, it's going to have its side effects. But what you really want is that you want to be able to control the process. So you want to be able to deny the glucose to the cancer cells as long as you need to get the treatment to work. And once you decide this is enough, you'll be able to stop it. And you can't do that with a new drug.
Well, now, chemotherapies have a half-life, like doxorubicin is 2 weeks, but what you're saying, because we use 10% of a normal dose, that we even control that too. Is that
Yeah,
correct?
you minimize the side effect. Of course, 2 weeks is a very long time for a drug to be around in the body. There are other drugs as well, so potentially they can be candidates for treatment.
Right. Like there's a one that you like to use. It's a couple F letters in there, something like that.
5FU,
And-
5 for your cell.
And that has a half-life of what, like
A very short half-life.
a day, I think it is.
It's 16 minutes.
16 minutes?
Yes.
Well, see, so if you 16 minutes, wow. So you started treating your first patient. You left Tucson and moved to China because you couldn't get anybody interested in doing the
See,
research.
there's nothing illegal about doing it since everything we use has already been approved and all the doses are already, being shown to be safe doses. But however, the medicine is not always practiced by doctors. It's also under control of insurance companies. So all malpractice, the regulations it requires that you follow a certain set of rules. So it's very difficult to get around that in the U.S.
One of our shareholders is a doctor.
Yeah.
And he believes in the treatment, and I asked him, why don't you do it? And he said that, I'm afraid of malpractice lawsuits.
Yeah.
And I thought, why? We're not doing anything wrong. And he said, it's because you're using only 10% of the chemotherapy.
Yeah.
And so if something doesn't go right, the lawyers will come after you and say, you should have used the standard dose, not 10% of the standard dose.
Yeah, in the United States, when a doctor is being sued for malpractice, they have a problem. They have to defend everything, why they're doing everything. The best way to defend it is to say everybody else does it this way, and we're just following the standard protocol. So anytime you do something that's not part of the standard protocol, you always at risk of losing in malpractice too. But
So why did you move to China?
But in China, there's a long tradition of Chinese medicine. So beyond the standard Western cancer treatment protocol, they also have a lot of Chinese medicine that they do for these patients. So frequently the patients will come and say, well, can you think of something else? Are there something else you can do other than chemotherapy, radiation therapy and more surgery? And
But back into the United States, because we want to treat dogs with this.
yes.
Most drugs that veterinarians use are people drugs.
Yes.
I believe only maybe 20% are created for dogs. And so they are considered what they call an off-label or gray label use of it. So there would be no problem because all the drugs we use, veterinarians use them right now on their dogs.
Yes.
And so there would be no FDA approval that we even have to get to treat dogs. We can just go in and treat them right away.
Yeah.
So that's the advantage that we have in the United States. So your first patient was your aunt.
Yeah, my aunt, and she was diagnosed with breast cancer, but because her older sister died of breast cancer, she didn't have any confidence in the traditional treatment. So she was looking for something better.
And you treated her in 2006?
Yeah, 2006, and the follow-up was a surgery. So, eventually we were able to remove what's remaining that did not get killed by the treatments.
Well, what I understand is it did not get, the cancer stem cells were all killed, and that's what stops us from spreading. But sometimes the original tumor, you don't kill all of it. And so
Yeah.
it has to be removed.
To be more precise, using the treatment, you can kill the cells that uses a lot of glucose. And these tends to be the cancer stem cells. These are the ones that can spread. So you kill these guys first, and the remaining ones, they will use less glucose. Some of them will use same amount of glucose as normal cells. These can be treated by surgery and do so very easily.
So a good combination, the best is that I can think of prostate cancer, breast cancer, a lot of cancers. In dogs, I can think of hemangiosarcoma, where you treat it, and then in dogs, if it's in the spleen, you take the spleen out, you treat them, and bam, the cancer will not come back.
Yeah, a really good example is a friend of mine, and she was diagnosed with breast cancer, except this cancer has spread to her spine, and she was treated with the treatment to kill the cells that needs a lot of glucose, and those are the cells in the spine, and also some of the original tumor cells, and then she got a small surgery and followed by more treatments. And in this case, we have a very good outcome. It's been about 4.5 years, and
4.5 years,
and she has no sign of any cancer.
And I won't mention her or what she does, but she is a professor at a very reputable college in the United States.
Yeah, she's a faculty member of the college. Yeah.
Tom, you've been great. You've been really helpful. I think you've explained to everybody listening to this a lot more than I've been able to explain to them. Now I want to talk about the fee we charge. Some people are hesitant to think it even works because we charge so little. There are a group of people that if you don't charge a lot, they think, well, this can't work. So tell me what happens to people in normal treatments of cancer financially, for example?
Yeah, the cost of treatment is a very big problem right now for the cancer industry, cancer research field. There was a study published just a couple years ago by the University of Arizona College of Public Health and their Arizona Cancer Center that showed that in the United States, 42.4% of the patients, only 2 years after they're diagnosed with cancer, they spent their entire life savings. So
including the insurance covering it and everything else.
Yes, this is what most people already have insurance.
Because some chemotherapy drugs and some treatment drugs, the co-pays are $5,000 and $10,000.
Yes, and like I said, it's a very big problem for the patients. So in this case, one of the reasons that I'm trying very hard to get the treatments to more people, more places, is because
and more dogs.
Yeah, and many people just simply cannot afford it. The new treatments that's being produced by the field, and it is not unusual for a new drug that gets on the market to cost tens of thousands of dollars, sometimes hundreds of thousands of dollars.
I read that the average cost or treatment for cancer is between $125,000 to $250,000. I had a gentleman say to me, one of the advisors we were talking to said, our treatment brings democracy to cancer treatment. We allow everybody to be treated and everybody to afford it. Would that be a good way to put it?
I think that's a very good way of explaining that we need to do this for more people, and instead of just a few who are lucky enough to be able to afford it.
And for dogs, there are 22 million dogs with cancer at any time, 6 million new cases in the United States. In humans, there's only 1.5 million new cases of cancer. So it's epidemic, and if we can help them and help people, then that's why we're both so excited. That's why we're trying to tell everybody of how great of a treatment this is. Tom, I want to thank you for spending this time with me. I always enjoy it when we get together. I know this is a quick trip for you, but I appreciate you taking the time.
It's a privilege to be back here in Texas.
Okay, thanks, buddy.